Hello, everyone. I'm Michiko Hayashi from Embodied Peace Project in Tokyo, Japan. Today, again, I'm very excited that I have Dr. Thomas Verny, who I interviewed a couple of months ago, and Jeff Granville from Seattle, whom I introduced again several months ago. And today I'm so happy because I'm combining these two my favorite people together so that we can discuss on Dr. Verny's new book entitled Embodied Mind. Let me introduce Dr. Verny first. By the way, thank you so much, Dr. Verny and Jeff, for being here with me today. Again, for the second time.
Yes, thank you. My honor.
Thank you. Let me introduce Dr. Verny. Dr. Thomas Verny is a world-renowned psychiatrist and the author of 8 books, including The Secret Life of the Unborn Baby. This is a very famous book that Dr. Verny wrote almost 40 years ago, and it was published in 28 countries and 47 scientific papers that he has written also, or more than that by now. He has previously taught at Harvard University and the University of Toronto, York University in Toronto, and St. Mary's University. So he is very, very well-known and very important professor and also the psychiatrist. And today I am very happy. Do you have, Dr. Verny, your new book already?
Yes, I do. I do.
Do you think you can show it to people now?
Sure.
And then meanwhile, I would like to introduce Jeff Granville, who lives in Seattle, Washington in the USA. And he is the founder and the president of nonprofit organization Mindful Presents. And he has been giving workshops to help all the parents and everyone who are dealing with the children and cancer and other diseases also. Okay, Dr. Verny, thank you for bringing your book. Yes, The Embodied Mind. That's the book. It's published around this time, right?
Yes, it came. Well, the official publication date is next Monday, but actually it's out already.
Oh, great. I hope I receive mine very soon. I can't wait.
You should be getting it the next few days.
Awesome.
Oh, wonderful. I'm so excited. I read everything, but I have not ordered it. So I'm going to order it on Amazon so I can receive the actual one. If I were close to you, I would love to have your autograph on it too, but
next time I'm in Japan.
Yes, definitely. Thank you. So let's start because Jeff and I have so many things that we want to discuss today. And well, Dr. Verny, you also established right after you wrote that The Secret Life of Unborn Child that was published by Random House in 1982, you established
Sorry to interrupt you, but it was published by Simon & Schuster.
Oh, Simon & Schuster, not Random House. Okay, thank you. And then you founded the Association for Prenatal and Perinatal Psychology and Health.
Yes, that's also correct.
Okay, thank you. So now to you, Jeff, about the book you wrote. We both read. We have before it was published, we just printed all that book and I read everything. Just have so many things that here.
Yeah, it's truly amazing, and it is really an honor, truly an honor to be able to get the manuscript and read it and digest it and start implementing the knowledge immediately. And before we get into the embodied mind, I want to just take a minute and talk about the importance of The Secret Life of the Unborn Child. Written 40 years ago, I can't help but think how much better society would be if we had 2 generations of this knowledge immediately downloaded into all of humanity. You think of 2 complete generations where that was practiced during childbirth and during pregnancy, even to the point of conception. So I just want to illustrate that that book is not just important 40 years ago, that book is important today. And after I read The Embodied Mind, I went back and read that book and shared it with my son who just had a child, and it was extremely important. And one of the things, and there's a couple things about this book that tie in to The Embodied Mind. And as you said when we talked, 40 years later, it just substantiates all the science and research you did 40 years ago. And The Embodied Mind is a complete springboard off of that. And the commonality is consciousness. It's our awareness of consciousness and having that awareness ahead of time, because never have I heard a statement so understated is that an ounce of prevention is better than a pound of cure, because you can't go back and undo the trauma that took place in utero. So it just can't be overstated. And like The Secret of the Unborn Child, I only hope that your book, your teaching that you're bringing to humanity from The Embodied Mind could be integrated immediately into everybody, because our society would be completely different with your teaching. So I just want to really honor what you've brought forward.
This is really extremely important.
Let me just say that you bring tears to my eyes, because your comments are just so kind and so understanding, you know, because I have struggled trying to publish this book, you know, for some time, and it has not been easy. And it is so wonderful to hear your kind of response, you know, which sort of rewards me for the millions of hours that I sweated, you know, over scientific journals, trying to understand, you know, things that I was never taught in school, that I had to relearn all by myself. It has been a difficult journey. So hearing words like yours are very healing, I guess. Healing.
Thank what you. A gift.
But that really comes from his heart, and that comes from my heart also. Before just 2 days ago, Jeff and I saw each other on Zoom to talk about how we're going to carry this today's interview. And he was honestly feeling what exactly he said right now. And I feel the same way, because something that not many people have not yet known about the importance of the memory, the holistic, something that we have to see holistically. And something that a very important thing is to know that babies do remember when they are already before they were born, and all the cells, all the tissues, everything in our body is affected by our consciousness. And that really, I mean, what you're just in this book of The Embodied Mind really just shows everything from the different angles, from scientifically, and so easy even for me to understand and read. And it's something, I mean, I'm not a native speaker, so it takes time, because sometimes I have to check with my dictionary to see the right, to understand the words. but still.
I did too.
Okay, well, thank you. That makes me feel good.
But you have
But
more of a
still,
challenge. Yeah.
so easy to understand and so interesting to go. This book makes me want to read until the end. And I have not really been so much into the book like this. And that shows how important this book is.
Well, I have made a really great effort to write in a way that the average intelligent person should have no trouble understanding it. Like I always try to define any scientific terms when I use them. I try not to use too much psycho babble, and so I'm glad to hear that you don't have too much trouble understanding it.
That was one most wonderful thing for everyone to be able to read easily.
Yeah, and I would like to add to that true genius is making very complex ideas very simple and easy to understand. So you've mastered that. And yeah, you're welcome. And with that, I still want to talk about a couple points of the secret because it leads right into the book. Of course, they go together perfectly. And you talk about the rhythmic order of the maternal heartbeat and the mother's desire and love for the unborn child are the two most deterministic factors in the child's sense of security and health moving forward. Yeah. And you're 40 years ago coining terms like coherence, heart coherence, being rhythmic order. And if the mother isn't looking forward to the delivery, isn't looking forward to the child, then she could never have coherence in her body. So being out of step and not having coherence leads to a number of disorders from early pregnancy on. So that is just so important, and it leads right into your new book.
Yeah, being in sync is really important. And I feel that that's happening right now between the three of us, that we are really on the same wavelengths, which makes the conversation very easy and enjoyable.
This is resonance and coherence.
Yes.
Yeah, beautiful.
Yeah. And, that's something I learned through heart math is that you can have personal coherence and that coherence is contagious. You can have mutual coherence in a group, and then you're an emergent total greater than the sum of your parts, and you bring more energy and consciousness to your life through that.
So, later on, I would like to show you the remote experiment that I did in July. I used 3 noodles. One, I asked 5 people from different continents around the world to send the intentions to these 3 different noodles. 1 ignored, 1 negative intention, 1 positive. And I would like you to see the result. I mean, I did not even write words, but all I did was ask them to send this intention to this noodle. And then the result is as I asked them. So, I mean, it doesn't matter where we are. Our consciousness goes beyond time and space. And this is really important for everyone to know, I think.
Okay, let's have a look.
You want to see it now?
Yes.
Oh,
yes.
Okay. All right. Let me see. Okay. Right here.
Which also, without writing words, is a clear indication that it's consciousness transferring the energy.
Exactly.
All right. Can you see this?
I can.
Oh, yeah.
All right. Now, A. The only thing I wrote was A and B and C so that the people who helped me with this experiment would know what to do. And for A noodle, I asked them to ignore. For B noodle, I asked them to send the ugly negative intentions. For C noodle, I asked them to send the loving thoughts to this noodle. And I think it was like 3 weeks after we started to do this experiment. And this is the result from three weeks.
3 weeks.
So you can see how everyone's intention affects the very
Yes.
subject
Yes.
in 3
These
weeks.
These are boiled noodles.
Boiled noodles.
Noodles. Okay, thank you. Yes,
Okay, so let me just close it.
wonderful. Yes, thank
Let's see. All right. So, and you know what, one more thing, if I may, I would like to just share this. About 800 years ago, the Roman emperor called Friedrich II. Do you know about him?
No.
He was wondering what happens if the babies are not taught to learn the language.
Mhm.
So, and then he was wondering how babies would learn to speak the language. And he thought that babies would say something. I mean, even though they're not taught to speak. So he asked his coworker to collect 50 newborn babies and isolated these 50 babies in one room. He told the nurses not to see the baby's eyes, not to smile at them, not to talk to them, but to give the milk and change the diapers without any affection or anything. And bathed babies without, just did what they had to do, they were told to do. In 1 year, within 1 year, all 50 babies died. So
that does not surprise me.
it's really, this is how much
that's horrible.
our affection, our consciousness, our heart affects.
Yeah, there was other research in the 1940s on foundling homes, and they compared children that were being raised in foundling homes and those that were being raised in prisons.
Mhm.
And in the foundling homes, they were treated just the way you described that Roman emperor.
Mhm.
Like they were fed, they were changed, but they were not spoken to, they were not played with because there were not enough nurses around.
Mhm.
And they were just preoccupied with hygiene, just keeping the kids clean. And the kids, many of them died. Many of them became very sick. None of them developed cognitively, intellectually, whereas the kids who were brought up in a prison surrounded by women who would talk to them and play with them were doing just fine.
Mhm.
Oh,
And that was called anaclitic depression in
Mhm.
1945.
1945.
1945, it was repeated, anaclitic depression. And out of that, eventually, the whole idea of bonding and attachment grew, because then psychiatrists started to look into this, what's really happening between the mother and the child after birth. So that brought about a whole paradigm shift in the way we treat children, because it was recognized how incredibly important those first few weeks and months are in the life of all of us.
Mhm.
Yeah, so dramatic. And
Dramatic.
obviously not a test we would be able to or care to repeat today. That's
Definitely
horrible.
not, definitely. And I'm sure you have heard of Harlow's monkeys.
Mhm.
Yes.
Same thing, just
Yeah.
horrible treatment of monkeys. And they just became vicious and attacking and really nasty and depressed.
Yeah. Yeah.
So
And
what happens in the world now? I mean, many parents they don't plan to ignore the children, but unintentionally, they are really ignoring, to me, by just looking at their cell phones all the time and not really talking to the children when they want the parents' attention.
Mhm.
It's really heartbreaking for me, because they have their desire and there's not really response coming back from the mother or father. It's lack of attention, loving attention.
Yes. Absolutely.
Yeah, one of the things that Dan Siegel, Dr. Dan Siegel taught me in his book Mindsight, who obviously gave you an amazing review of your book. And
God bless him. God bless him.
God bless him, is right, because just like you, what I do, what I feel my job, my gift is getting information from all of you learned masters and being the consciousness in the middle and then applying it, everything that is congruent in all your teachings becomes my practice. And one of the things that Dan Siegel taught me in Mindsight is about mirror neurons and how when a baby is born, they have zero identity. They have no sense of self. And it's based on the reaction of their caregiver that they get their own identity. He actually says a mind isn't real until another makes it so. And that just really resonated with me about the interaction of, like you're saying, the babies that are ignored can go all the way to death without that interaction and feedback to make them who they are.
It's almost like the noodle photo of being ignored.
Yeah.
Mm-hmm.
Yeah.
Mm-hmm.
We're not giving any energy or loving energy. So it's like, Dr. Verny, you wrote about the heart rhythmic resonance between mother and the baby or child. Our heart has the electromagnetic field.
Yes.
And that's something that we really need to know, be aware that our heart is generating that energy.
Yes. People don't realize that.
But when we have, like, when we are heartbroken, it's not brain broken. We say heartbroken because our heart is in pain.
That's right.
That's how much our heart really is important. Yeah, let me ask you about this heart transplant. This is in your book, you wrote about this heart transplant. I thought this is really, really a significant study that you did, and important for all people to learn, I think, because you gave some examples of the people who have had the heart transplant, what happens to the recipient when after receiving this heart from donors. And you showed how donors' personality is adapted to the recipient.
Yes.
Or the food.
Yes.
Something that the donor was like 19-year-old girl,
right,
and whose heart was transplanted to 29-year-old woman, and this recipient loved meat, but this donor was vegetarian and she did not like meat. This recipient, right after she's had this new heart from this donor, started to love vegetables, started to hate meat, things like that. I mean, how can that happen if the heart is considered, it is just a heart?
Exactly.
Is an organ.
Exactly.
And well, Jeff, you said something about that.
Oh, yes. I had the opportunity when I was at the Ronald McDonald House with my son on his journey to receive 2 of the M-Wave units from HeartMath. And one of the things I did is I worked with kids who had heart transplants and were denerved. So the major neurological connection between the heart and the brain was disconnected. But through the research, I learned that the heart communicates to the brain and mind body in 8 different ways. So just like a blind person can hear better and even learn to echolocate, I showed the kids that if they make a biophysical connection to their heartbeat, the brain will then entrain to that heartbeat and they will become in sync. Because I actually worked with adult patients who had heart transplants, and they were thinking they were losing their mind because they were having somebody else's dreams and they were having feelings they didn't understand.
Where was
and
this? Where did you have this experience?
After we lived at the Ronald McDonald House for 4.5 years, my son qualified for a kidney transplant. So we moved into an apartment building that housed what's called the Transplant House, which had 50 apartments. So any families coming into the Seattle area for solid organ donation recipients could stay there in an isolation room and recover. And I was doing maintenance work to try to, I spent 4.5 years unemployed. So I was trying to bridge back into work. So I would go into a room to replace, this is a literal situation. I went into a room to replace the battery in the smoke detector.
Yes.
And the lady was kind of scrambling around. I saw she had a medical bracelet. I could see a scar on her chest. And I asked her how she was doing. I just struck up a heartfelt conversation. And she said, well, actually, I'm not doing very good. I'm having someone else's dreams and I'm really disconnected with my feelings. And I said, well, did they talk to you about being denerved? And she said, no. And I said, well, one of the main connections from the heart to the mind body is through the vagal nerves.
Right.
And when those are denerved, you lose that. So that's why you're feeling disconnected from your own emotions. And there's ways to biohack around that to give you clarity, and biophysical connection is one of them. And then she said, well, what about my dreams? Those are dreams from somebody else. And I said, well, did they talk to you about cellular memory transfer? And she said, no, what is that? So I explained it, and she goes, those doctors told me that these were both byproducts of my anti-rejection meds.
Sure. Yeah.
So working with heart math and showing them that biophysical connection completely cleared up the disconnection of their own feeling. And the most important part is they had an answer for why.
Yes. And very often when people like you or I are not around, some of these people with these strange dreams and strange impressions get treated as if they were psychotic.
They were.
Psychotic,
yes.
As if there was something wrong with their head, right?
Yeah, they said it was the effect of the anti-rejection meds, and they were gonna give them another anti-psychosis med to treat that symptom. So it was another drug to treat a symptom.
Sure, we have a drug for everything.
Yep.
Yeah, Dr. Verny, in your book, you talked about this heart transplants, and you gave some examples of the donors and recipient, and then this donor had died from accident.
Yes.
And the recipient started right after she had this donor's heart. She started having the dreams of having the accidents also. So how does that happen? And you said that 1 out of 3 people have applied or adopted the donor's personality or some kind of characteristics.
Yes.
So that shows how much impact the heart has been given to the people. And that's something I think it's very important for people who need the transplants to have it. But at the same time, I think it's really important for people to know that there's they will most likely adopt some kind of information or memory from the donors.
Exactly, and I do hope that this book is going to open up some channels of communication, between scientists and heart transplants, because at the moment, doctors don't accept this theory by and large, I mean, a few of them do, but the large majority does not. And what I really hate to see happen is that so many of these heart transplant patients, when they do start getting some other personality, what should we say, likes and dislikes and changes, that they are being treated as if they were crazy instead of as this is what's to be expected.
Right.
Yes.
So, it's the same thing with scientists, many scientists would like to explore this subject more, but because it is looked down upon, because it is treated as something that, only California hippies believe in, then it's not being scientifically accepted. And I hope that we can change that.
Yeah.
Yeah.
I hope
Well,
so too.
I think hearing it from you will go a lot further than hearing it from me, the maintenance guy. So I appreciate, and in your book, you reference Paul Pearsall's book, The Heart Code, where he does an amazing job of laying out the entire history and how it plays in. And I loved to see that you referenced that, because that, again, just reaffirms all the teachings that I've tried to absorb and communicate to other people to help them out of this situation.
Just to tell you a very brief anecdote, when I put that into my book proposal and I sent it to my literary agent in New York, he absolutely objected to it strenuously. The moment you put in any reference to Nexus magazine, which is, the Heart Math Institute sort of favorite magazine, the moment you mention Nexus, every editor in the large publishing houses is going to reject this book.
Yeah. Well, I think that really speaks to your dedication to the truth, because you know it as truth.
Right.
The evidence shows that it's truth.
Right.
And you look through history, and truth might resonate to those who are truthful, but when there's a distruth, a distrust in society, they fight you adamantly.
Exactly.
They reject the truth.
Yes. So anyway, I took it out and then I put it back into the book once it was accepted.
Good for you. Good for you. Good for everybody.
For everybody.
That will make a difference. That will make a
Dr.
difference.
Verny, I have question. What we know that from your book, we know that a heart and brain, of course, that it's well known, but heart also has the memory. In all the tissues and cells have the memory of the person, or from this is something very important. Like you said in that book, in the Embodied Mind, it said there was an example of someone who went through this severe trauma of Nazis in the World War II.
That's right. Yes.
And then their grandchildren are born and have more like a mental problem or depression. Yes. So that shows our trauma is delivered or carried on.
Yes.
Throughout the generations.
Yes.
And that's another thing that we really it will be helpful for everyone to learn, because we're not just living for ourselves, but we're giving that our information, our conscious information to our children and grandchildren and next generations. And that we are affecting those lives also, right?
Yes, yes, yes. And that is one of the imperatives of this book, really, that I was trying to put across, that, if you want to have healthy children, live a healthy life. It's as simple as that. Sorry.
I'm sorry. It really, I have been using this machine, vibrational machine that Dr. Emoto used to heal or help people with the vibrational machine and water. And that's how he went into this research on water. So he treated more than 10,000 people with this vibrational machine and water, imprinting the information into water. So that was the beginning of his journey on water. But we also continue to do this Harlow vibration measurement. And I have my machine, evolved machine. It's just a small one. And whenever I need to, I help people using this machine. And with American people, when I do this measure, help people, I ask about their grandparents and parents, what kind of, how they lived, if they had any problem before, if they remember. And then I discovered, even before I read this book, your book, I discovered, I think it was about a couple of years ago, I discovered that many people in the United States whose grandparents came from Europe at that time. And they went through such severe life when they moved to the United States from Europe. So those grandchildren have many problems.
Yes.
And then when I read your book, that really totally made sense, that those information DNA is carried on and cause the problem, even though the children or those people after second generation don't know why they have what they have. So it's really clearly shown in this Harlow machine, as well as my father, who was the priest of the Buddhist priest. He became the priest because he said, if I become the Buddhist priest and offer the prayer to all the ancestors and all the people whom our ancestors had killed, because I'm from the very old family and the samurai family. So my ancestors had killed many people.
Right.
And so he said, I heal those people, then the 3 generations from me will be saved. So that's me and my sons also.
That's beautiful.
So all these things are really, I mean, related to what you say, what I have been discovering, and what my father said as a Buddhist priest. So it's very interesting what you wrote.
The information that you sent me about the chimera experiments in China were also very interesting. Thank you for that.
Sure. This is a research team in China and the United States have created the world's first chimera by injecting human cells into monkey embryo.
Yeah, also into rats, I think.
Rats. And they have been making progress with sheep and pigs also.
Yeah.
What happens to, I mean, their purpose is to be able to use their internal organs for the transplants into human. Then I'm just saying, if now that we know that human cells and tissues and everything has the memory, then what happens to those internal, I mean, organs when we have to have the transplants from them? What would you think?
Well, if you ask me, I would think that it's a very bad idea. I think that we are playing, we are playing God here.
I know.
And that never works out well for humanity. I think that, I mean, obviously, based on the research that I've done for my book, I do believe that every cell in our bodies contains some fragments, some tiny bits of memory, and that all of them together give us our mind when they work together. So I don't know how much memory is contained, in a kidney or a liver. But it certainly would have some memory in it, and it would have the memory of that animal, whether it's a monkey or a mouse or a rat or whatever. And those memories combined with human memories cannot cannot possibly be good.
No.
No.
And I would totally agree with that, because the same surgeon who does a heart transplant in a human and pretends he's just plumbing a new pump in, and that there's no energetic or cellular memory or connection in any other way, is the same type of doctor that's going to use animal parts in humans because they think there's nothing but a mechanical pump being transferred or a kidney being transferred. They're not grasping the totalitarian influence that consciousness plays in every cell of our body. So
this is, I totally agree with you. And this is the problem that I've had with many obstetricians and many doctors also, who are only concerned with helping a woman give birth to a healthy child. But what happens psychologically before birth, during birth, after birth, is not taken into consideration at all. Not at all. So
No.
you can say nasty things to the woman. You can say nasty things about the child. Oh my God, isn't he ugly looking?
Oh my God.
Not worry that that is going to have any impact on anybody present. And of course it does.
yes.
And it's the same thing, it's the same thing in many areas of science and medicine, where doctors are not concerned with the psyche, with the emotions of their patients, only concerned with, I don't know, the aortic valve, or with the high blood pressure or diabetes or whatever. It's a case of diabetes instead of a case of Jeff Granville.
Yes.
Oh.
Yes. And that's a great segue to part of your book. You reference Howard Bessel von der Kolk.
Yes.
And it says that your body remembers everything: sounds, smells, touches, taste. Memory is not held in your mind, locked away somewhere in the processes of the brain. Instead, it's held in your body all the way down at a cellular level. And even true when somebody's under anesthesia.
Absolutely.
So everything the surgeon says during your surgery, when your conscious mind is disengaged, is subconsciously programmed and recorded by the autonomic consciousness to play out later.
Yeah, that's right. That's right. And it will have an impact on the body too. I mean, if the doctor should say, oh my God, I'm sorry, I think I just nicked her artery. This is,
oh my God.
This is going to have a shock impact on the person under anesthesia. Whether they are under anesthesia or not doesn't matter. They are still processing that.
Right. I just had an experience, a couple sessions with a client that I'm working with, that I do the heart math and the coherence breathing that I offer, that I developed with my son. And she had a surgery on her foot. She damaged her foot hiking. And she had a surgery on her foot from a surgeon she didn't like, that said that she was emotionally unstable and this and that, and was talking bad about her. And she believes that while she was under, they were saying snide remarks about her. And they put a screw in her foot when they weren't supposed to, didn't say they were going to, and her body started to reject it. And it shouldn't. It should accept the screw, but it was rejecting it. And then
because of the person who gave it to her, probably.
Because of the person, the consciousness of the person who gave it to her transferred, as your book proves, transfer of consciousness really happens.
Yes.
And so then we found another doctor that was more in tune to her well-being, and got him to remove the screw. And through our somatic trauma imprint release that we do, we released the somatic trauma, and she remembered some of the things that were said during while she was under anesthesia.
Wow.
Yeah.
Which, according to your book and your teachings, is completely legitimately possible.
Absolutely. One of the things that I always say when I'm lecturing about pre and perinatal psychology is that only people who love children should be present at birth.
Yeah.
Amen.
Exactly.
You don't want someone there. And believe me, there are quite a few obstetricians who don't love children.
Oh gosh, that really
Yeah.
hurts my
Unfortunately.
heart.
No?
One of the interesting things is that through hypnosis, many people start to remember about their past experience or even a previous life. How does that happen if our cells or DNA or something does not remember it, or consciousness? I mean, it doesn't really make sense. So like being anesthesia, it's the same thing. Our consciousness or our cells or tissues or in our energetic field, we remember everything, I think.
Absolutely. Yes.
Yes, and I would love your validation on this, because as I understand it, and I speak to people, there's a difference between the conscious mind and the autonomic consciousness. The autonomic consciousness is said to process 15 million bits of information continually, while your conscious mind only processes about 50 bits of information. So when we are disconnected by anesthesia or sleep, our autonomic consciousness continues to record. So stored somatic trauma, like at a surgical site, is the autonomic consciousness reminding the conscious mind while it was disengaged that there's pain and trauma at that site. And that's how we release that somatic trauma through our breath work.
Yes, absolutely. Yes.
Yes.
So
yes.
You still do that work?
Yes, I do. It's very successful.
Wonderful.
Yes. And this is a question that I want to ask you.
Go ahead.
Based on, you reference Wilhelm Reich and body armoring.
Yes.
And you say painful memories create hardened tissue. The longer it persists, the more it becomes part of your body armor, especially unresolved emotional energy. This disorganized energy in the body is walled off from consciousness.
Yes.
So it's like we were talking before, a snapshot, an emotional snapshot of the event is carried in the soma.
Right.
And it plays back whenever it's agitated or stimulated.
Yeah, that's right.
And it can't be released because it's walled off from consciousness.
It's hard to release it. It's very hard. It can be, but it's time and effort. Yeah. No, I wouldn't be hopeless about it, but it takes time and effort, and you may have to experiment, because not every kind of therapy or every modality works with everyone.
Mm-hmm.
Right.
Okay. I mean, that's one of the confusing and difficult things about psychiatry, when perhaps one person says, well, I had hypnosis and it really helped me. And another person cannot go under hypnosis. Like, it will just not work on him or her, right? So people have to realize that, what works for one person does not necessarily work for another. And that you have to try again and again until you find the technique or the person with the technique who can help you.
Yes, that's beautiful. That's beautiful.
I think that's really, really, really important, because very often people will say, well, how come that Joni was helped by this and I'm not? Well, because you're different.
Different.
Yes.
Yeah.
Different. And you may need a different approach. Hypnosis, for example, never worked on me. And hypnosis does not usually work on nurses and doctors, by the way, usually doesn't. But on the other hand, other methods work very well on me. So, I took psilocybin, I've taken LSD when it was legal. and many other guided imagery has worked very well, for example, on me, but hypnosis did not.
Right.
And I had David Cheek, who you may have heard of or not, a very famous California medical hypnotherapist, deceased now, and he has written many books on hypnosis. And he tried to hypnotize me, and nothing, absolutely nothing happened.
Wow.
Yeah.
So you just don't know. But it's very important for our listeners to realize, that if one method does not work, try another.
Absolutely. And that's something that we talk about too, is you have multiple arrows in your quiver, multiple tools in your toolbox, because just like gong therapy relaxes some people, but it agitates me. It's right. It just doesn't resonate.
Yes, exactly. Yeah. So people who are listening, don't give up hope. Keep searching.
Yeah.
I really would like medical doctors and nurses to, I mean, of course, all people, but medical doctors and nurses to read your new book, The Embodied Mind, because this really would change their mind, their ideas, or whatever they have studied, learned. I think this is really important when they are dealing with their patients, and to be compassionate, to understanding, instead of saying, well, they're under anesthesia. They don't know what I'm saying. They don't know what we are doing right now. Oops, we made a mistake. But every single thing that they do for the patient, each single patient does remember and can feel it. It's something very important.
Yes, I agree with you. How many people are listening to your program? Do you have any idea?
I don't know. I will be hopefully I will be able to expand this. Right now, probably about 500 people or so, or up to 1,000, and I will try to promote more and more. And I was just wondering, it would be really interesting, or it would give even more impact to more people when we do maybe a Zoom conference with you, Dr. Lipton, Bruce Lipton, and as I was reading your book about heart plants and how our consciousness affects two people, I mean, together or in distance. There's doctor called Dr. Dean Rading at the Noetic Science Institute in California. I visited Dr. Dean Rading with Dr. Emoto in, I think it was 2005. He does the research on consciousness. And at that time, he showed us probably about 100 data and showing that one person, there are just one couple, and they're very close. They can be sisters, or they can be a couple or married couple. And one person would stay in this specific field in the room, and the other person will be doing something remotely. They would not know what they're doing. But one day, this person who was out there, probably being far away, had a bee has bitten him. And then he said, ouch, at that time. At the very moment, the person in that room, her brain reacted without knowing it. That's how our consciousness are related when we are so close to each other. And we have done the water experiments remotely, like 1,000 people sending love and gratitude to water, and then remotely we did the experiments together. So we can all combine it along with Dr. Lipton and you. We're all talking about the same thing. I mean, from the different angles, and that would give a great impact, I think. And I just came up with this idea of doing this Zoom conference, and doing it together, just, you know, and if we could have this opportunity, I would love to do that.
Okay, sounds good. Sounds interesting.
Yeah. Okay. Well, thank you. Let me just talk to you again separately.
Sure. Okay. Okay. So we have a few more minutes left. Is there
Yes,
anything you'd
Jeff?
like to ask me? Yes.
Yeah, I would like to say something that, you know, you talked about psilocybin and you talked about LSD and learning and watching Timothy Leary and Ram Dass. And the main takeaway is that set and setting determine the experience, and the experience determines the outcome. And just like a mother's birth plan or a surgeon talking during surgery, the set and setting directly affect the experience, and that affects the outcome. So back to the ounce of prevention worth a pound of cure. I think that that's where I really believe that the teachings you're bringing forward really do penetrate all aspects of our life, from birth to surgery to relationships. That's why I think it's so important that it be integrated and shared as much as possible. And you know, like we say, the medical doctors learn within this box, and the AMA keeps them so busy all the time. They don't have time to look outside that box.
Right.
So we need to, as a group, shake them up.
Yeah.
And get this to happen. And that is my mission through my nonprofit Mindful Presence, is bringing consciousness and Stance with Spirit into the Western medical profession, because if it can happen in the pediatric environment, it can happen anywhere. And your work absolutely affirms that. So I appreciate you so much.
I've been trying to shake up the medical profession for 40 years.
Oh gosh.
And
Thank you.
And my experience has been that the best way, not exactly the only way, but the best way to reach medical doctors is through their wives.
Through their wives?
Through their wives. Women are much more open to psychology and this kind of psychology. You know, this humanistic psychology that we are talking about. Women are much more open to it than men.
Well, I think we are right brain people.
Yes, much more right brain. That's right. Right. And so women are much more open to it. And once women sort of read the book and hear about this, then they can talk to their husbands and gradually, you know, open up some channels of communication.
Kind of educate them.
That's right.
That's beautiful.
That's right. That's right. That's right.
Yeah, because I thought your book was so fascinating. And I actually talked to my own husband also. I said, listen to this. I mean, you read this. I mean, this is really what happens to this.
What did your husband say?
He was just listening to them. My gosh, is that so? I didn't even know. I was talking about heart transplant, and he was just amazed how it affects the donors. The personality is affecting the recipient's personality and like and dislike. Right. So, I mean, just little by little, we can share the information and start to learn more and more. And then we are really, that way we can be changing the world together.
Right.
Just one person cannot do it, but together we can do in the small, and it's creating the electromagnetic field together, expanding it.
That's right. Well, it was a real pleasure talking to the two of you. I really appreciate your interest.
Thank you.
My honor. Thank you very much.
Thank you so much, Dr. Verny. And we'll stay in touch.
We'll stay in touch, and you will send me
recording. Okay.
And then I will put it on my social media.
Please do. Thank you.
As I will as well. Thank you. Thank you,
Good.
Thomas.
Good. I'll put it on YouTube, on my YouTube channel. Okay.
Wonderful. Thank you, Thomas. You have a nice evening. Thank you so much for being with us
Thank you,
today.
Chico. Thank you, Jeff. Talk to you one of these days again. Okay.
Again.
You bet. Thank you. Thank you.
Thank
Bye-bye.
you.
Bye-bye.
Thank you very much, everyone, for watching us today. And I will see you again soon. And please remember that I love you so much. Bye-bye.